Hello Facebook friends, we are coming to you live from Contour Medical. If you suffer from loose skin, fine lines, maybe acne scars, or even stretch marks, there is a new treatment available that can get rid of these trouble spots for good. Look at this before and after. We're inside Contour Medical with Dr. J.D. McCoy. He is going to take us through one of these new procedures live on Facebook, as you always do. Good to see you again.
Nice to see you.
What is this treatment called?
This is an RF microneedling device. It's called the INTRAcel.
Okay.
And what it does is it takes microneedling to the next level. And I've been doing microneedling for over 7 years, which is the concept of just using rapid movement of a very fine, tiny needle in and out to stimulate collagen.
Right, and we've seen you do some live procedures before, and we're going to be taking your questions live as well. Microneedling is a procedure we talk about on the show, but the interesting part about this is the device.
Yes.
Show us the device. How does this device work?
So basically what happens is the microneedles, I'm going to turn this on, you can see those microneedles come out, and as the needle penetrates through the skin, which we're going to see in a few moments, it's actually delivering energy. So we're getting the combination of the collagen stimulation from the needle itself, and then you get the added benefit of the energy that's delivered by the needle under the skin.
Right, and some of the other treatments that we've done, they have not been graphic. This may be a little graphic, and we do want to warn you, you might see a little blood. And what is that we're seeing exactly?
Basically just some pinpoint bleeding from where the microneedles go in. I'm going to do a little...
So Savannah has been numbed. We want to tell you, Savannah is the model
Yeah, we use
today.
a topical numbing.
So she does have some
I'm going to do one point right here. Oh, it's on standby. Let's get that going.
Bipolar mode.
Do you feel that at all, Savannah?
Hardly.
Hardly.
Hardly?
Okay.
Is that super easy?
That's easy.
Let's go up one more level then.
All right, so when you go up a level, what are you doing to the skin?
Basically, all I'm doing is I'm delivering more energy. More energy will translate into more collagen, more tightening, more improvement in scars. The thing that's really unique about this is because the energy is delivered deeper in the tissue through the needle, it's safe with any skin type.
So what are we doing to the skin? You said we're bringing the collagen back out, correct? Is it going to smooth the skin?
That's still okay?
That's okay.
Good. Basically, with the energy, it is going to improve the skin quality, so the texture. It's going to improve the tightness of the skin. It will help with any defects like an acne scar. It will help with stretch marks, so this can be used on the face and the body.
Yeah, so as you get started, I want to take everybody back over here because I think it's important so you see the multiple things. So this is the loose skin, that's the before and after. This is the stretch marks. So this is, women get these after pregnancy, maybe they've lost weight. Look at the difference. And Dr. McCoy, how long is the difference between the before and afters?
These are all approximately 6 weeks.
So 6 weeks. So this is acne scars. If you suffer from acne, maybe in your teens. Look at the before and after, such a dramatic difference. The loose skin. How can the microneedling address so many different issues?
Well, a lot of it has to do with the versatility of the energy, meaning I can be delivering a lot of energy deep in the tissue. I can alter the length of the depth of the needle, so depending if it's a superficial problem. So basically we can modify the way the treatment is done. The other thing that's unique with this device compared to every other device on the market is that with this device I can actually deliver different types of radio frequency. It's a little complicated, but most of the devices are bipolar energy. This one is bipolar and monopolar, which just means we can get more tightening than any other device out there.
So we have a question from Leanne. She says, is this great for older skin too?
Absolutely. The thing that's different when it comes to older patients versus a younger patient, and this comes up a lot, is that an older patient, it will take a little bit longer to stimulate the collagen. Meaning, they'll still get a good result, but it might take a little bit longer to see the full result compared to a younger patient.
And for those just joining us, we are doing a microneedling procedure. Dr. McCoy is doing a microneedling procedure here at Contour Medical. We have opened this up to you to ask questions, whether it be about microneedling or any of the other treatments that you offer. And I don't know if everyone got a chance to see how many needles go in at once, because there's about a dozen needles in this.
Total is actually 49 needles total.
49.
So I don't know if you can see behind with the glove there. So that each time those are coming out, and then the energy is being delivered between those needles. Are you doing okay, Savannah?
Yes.
And
Yeah.
Savannah she's a trooper. Let me tell you, she does have some balls that you've given her. Those are like resistance balls,
Little
tension
squeeze balls, yeah,
in
just
case she needs them.
I always joke it so that they don't squeeze me.
Now, how are you? I know you're doing the right side of her face right now.
Yeah.
How do you kind of move about? How do you know where to go and where?
Basically, I'm just going in a very tight row. In fact, I'm actually overlapping 50%, so it's a way to almost do 2 passes at one time. So I'm not moving the entire length of all the needles, so there's a little bit of overlap. And what that does is it just makes the treatment go a little bit quicker, which is a good thing because it is a little uncomfortable. Or, as Savannah here on the table likes to say, a little bit spicy.
Spicy, I like that.
What would you rate it out of 10, Savannah? 10 being the worst discomfort.
A 3.
A 3.
Wow, a
So there you
3.
go. That's
okay,
pretty
so
good,
that's
man.
pretty good.
That's
And
pretty
you said
good.
there'd be a little bit of blood pooling, but we don't see any.
Yeah, we don't have much at all.
Yeah.
She's just not
And
a
is there
bleeder.
medicine inside of those needles?
No, there's no medicine. The medicine is, you can think of it like injectable energy, injectable
Okay.
radio frequency is
So
what's
it's just
happening there.
injecting and getting that
And then it
collagen
comes to this
stimulated.
side.
What will her skin look like after the treatment?
Immediately after the treatment, it'll look a little pink, maybe a little red, and within a couple hours, it actually won't look anything significant at all. The next day, it typically looks like you've had a little bit too much sun.
Okay.
So
Does
you
she have
almost-
to do anything special? Stay out of the sun, not wear makeup?
There's no restrictions as far as makeup, and there's no restrictions as far as going outdoors. I just want to make sure that patients are wearing sunscreen.
Okay. And what about all skin types? Can anyone use this?
Yes. Yeah, this is safe for all skin types. We have a little bit different settings depending on how dark the skin is, but because the energy is being delivered under the skin and we're not heating the superficial skin, it's safe with darker skin.
So who benefits from microneedling?
Well, microneedling we use in the office as a maintenance treatment that a younger or older patient can do. The difference when we add the radio frequency, like in this treatment, is that when we do this treatment, it's like getting the results of regular microneedling. I'd say 5 to 6 regular microneedlings is equal to 1
Wow.
microneedling with radio frequency.
Okay, so that's just a boost, if you will. How many
A super
treatments-
boost.
How many treatments does a patient need?
Depending on the issue, it'd be anywhere from 1 to 3 treatments typically.
And then another question, Dr. McCoy, how often can I do this?
The treatment is typically done on a monthly basis.
Okay.
But there's some flexibility on the scheduling, so it's something that you could do monthly, you could do 6 weeks apart. Some patients, they could wait months and months apart if need be based on their schedule.
So if you come in for stretch marks, then obviously you just target that area.
Correct.
And you said it's about 6 weeks, regardless of what you're treating, whether it be loose skin, whether it be
The
stretch
reason,
marks.
and you'll hear 6 weeks is kind of the magic number for a lot of things, and there's a reason for it, and it's because it takes your body 45 days to make brand new collagen. So it has to do at that time frame, 45 days, which is 6 weeks.
Okay. Interesting. This is pretty intense, but she's doing great.
She is doing
She's
great.
doing
Would
great.
you like, let's do your nose.
'Kay.
You up for it?
Yeah.
Okay. So
Now-
just breathe through your mouth, because I might be pinching your nose a little bit.
And is it important to do the entire face?
You don't have to do the entire face. So some patients, if they have a specific area where they have bad scarring, you might end up doing more in that region.
I know Savannah said she suffered from acne scars.
Yeah, and this can be used for active acne or for acne scars. Breathe through that mouth.
I'm going to sit silently while you're doing the nose before I ask you the next question, because I know this is a tight area there.
That's okay.
Okay.
That's okay.
So the next question, someone wants to know, what parts of the body can we do this treatment on?
Any part of the body.
Any
There's
part of
no
the body.
limitation. So the most common would be the area when we're talking body treatment is typically scars or stretch marks. So it would typically be belly, legs, thighs. But technically you could do arms, you could do any area. But the most common areas would be belly stretch marks, thigh stretch marks on the body, and then obviously full face.
So when you look at Savannah's face, what jumps out at you? Do you see acne scars?
Now she's got a little some texture irregularity in the cheek. Nothing significant. I think she'll actually only need the one treatment. I'm gonna just modify the depth of the needles right here.
So you just change the depth. So now it's going to go deeper?
It's gonna go more superficial because I'm a little bit closer to the eye.
Okay. So not as deep.
Correct. And this device is very precise, meaning the depth is really spot on. And when I compared it to other RF microneedling devices, this was my preference.
Why do you like this machine so much? Because of that?
Because of that, and the other thing that's unique is the ability to change the way the energy is delivered. No other device. Meaning, so we have 49 needles. Okay, so 49. Actually, I'm gonna turn this so that you see more of the needles.
We won't put that on Savannah. We're just turning it for you guys. Okay.
So we have 49 needles. So we could have it so that the energy is going from needle to needle. So that's one way the energy can be delivered. That's how most devices are. This one also has the ability, when the needle goes into the skin, the energy delivers out of the needle deeper into the tissue. So what it means is we can deliver deeper energy than other devices that are on the market.
He's changing it back to
Yeah,
the more,
I'm remembering to
to the
change
more
it back.
superficial one for us. And you guys offer a number of services here, in addition to microneedling. What
Correct.
else do you offer here?
So basically, for the full face and body, we specialize in non-surgical treatment. So everything from laser resurfacing to injectable volume correction to Botox, fillers. We also, on the body, we basically do every device that's available for you, as you know.
Yeah.
Every device that's available for the body we have.
And you're constantly reinventing, not yourself so much, but making sure you're on the cutting edge of technology. And I know there's a new machine that you're really excited about. We're going to do what we do in the industry call a teaser. Tell us a little bit about this machine and why it's one to watch.
Okay, this is something very cool. I can't actually give a lot of details.
Okay.
But it is the first device of its kind that is used for body contouring, but uniquely, this device actually stimulates new muscle growth.
That's mind-blowing.
So
that is muscle, I mean, building muscle and reducing fat simultaneously.
Correct.
That's never been done before.
Never.
How many clinics are offering this right now?
There will be 3 offices in the country, and we'll be one of 3. The only
Contour
one.
Medical.
That's right.
One of 3 in the
So
country.
the main areas that device will be used is for treating the abdomen and for lifting the butt. So it's going to be an alternative to the Brazilian butt lift.
It's mind-blowing because you really do have state-of-the-art equipment here at Contour Medical. You are always staying on the cutting edge. Remind people a little bit about your history, Dr. McCoy, how you got started, and why this is such a passion for you.
Yeah, this is definitely a passion, and it's not something that I would have ever expected. In fact, earlier today I was chatting with 3 colleagues that graduated with me 15 years ago in school, and it's one of those things that I never thought that I would be doing this, but it happened by accident, just doing some cosmetic treatment for a couple of my HIV patients who were my main patients at the time were cancer and HIV. And the light bulb went off when I actually treated those patients and made them happy. Improved some cosmetic deficits that can happen because of AIDS and HIV, and that can be very devastating. And when I improved that and got a smile, it was life-changing. And I never looked back after that, and have focused on the non-surgical treatments that we can use. And it's been exciting because the evolution in this technology over the last 5 years especially. But I've been doing this for 13 years now, so it's not my first rodeo. But
and you train people, and you
Yeah.
are a master at what you do, and you do it naturally in the sense that people don't look like they had anything done. Is that always your goal? Is to just make people look a little better, enhance their natural beauty?
yeah, I would say that the best way to think about it is really good work is corrective work, meaning we're correcting what's changed, what's been lost. And when you do that, all you're doing is making someone a younger version of themselves. So they always look like themselves. It's corrective. As soon as you start creating, you're creating something that was never there, that's where it can start to look a little bit weird. In my patients and myself, that's far from what I want.
I love that. That's a beautiful way of explaining it. And for those of you just joining us here on Facebook Live, we're inside Contour Medical. Dr. J.D. McCoy, the founder and the medical
Are you okay with that?
aesthetic medical director here, and he's showing us how he's doing radiofrequency microneedling. It works on a number of problem areas for people, including acne scars, stretch marks, fine lines, loose skin. The treatment takes about 20 minutes.
Yeah, that's about right.
And we've almost come to the very end of the treatment. We've learned a little bit about this procedure, and it's several treatments that you could get if you need it. You may not. Savannah is one of those who doesn't. She might only be able to get away
Yeah,
with
I
one.
think some patients that just have a minor texture irregularity or something small, it could be a single treatment. The majority, it's going to be a range of 1 to 3.
And we're going to let Dr. McCoy finish, but I want to show you, as we close up, just a couple of before and afters, so you can see the before and afters, because on Savannah it's kind of tough to see the after right away. But this is the stretch marks, about 6 weeks difference between this radio frequency microneedling. You see the major stretch marks here in the buttocks area, completely gone 6 weeks later. Acne scars, same effect, about 6 weeks. This is a 38-year-old male who had this treatment done. And the last, of course, is the fine lines and the loose skin. Look at the difference. This is the before, this is the after. So these are options that are available to you here, as well as a number of other treatments. If there are things that are bothering you and you want to just enhance your natural beauty, give Dr. J.D. McCoy a call here at Contour Medical, or visit their website, contourmedical.com.